Housekeeping. They're gonna be letting people in. The mics pick up really well in this room. That's a little bit of the housekeeping I would say, if we can keep, not that everybody here is really cacophonous with their chit chat, but if you are, it will get picked up. And we want to make sure that those online have their video cameras enabled. That we stay on mute unless you're, called on to speak. You can submit any questions and commentary using the chat function. And we will let everybody know that this meeting will be recorded. There's also, for those of us in here, there's bathrooms down the hallway and just on the left. The other thing I wanted to say for housekeeping, can't think of it right now, but if it comes to me, I'll just let you know. I think we can change slides. And I'm going to introduce myself and D'Angelo, who helped put this whole event together. He was going to go through the housekeeping slides, but he is now managing a small hybrid fire. So thank you, D'Angelo. D'Angelo, when folks start, there's more significant presence online.
Keep on going right now.
They are, okay, great. We might want to do that housekeeping for them again in like 5 minutes. Anyhow, so welcome. So good afternoon. My name is Hillary Tellison. I'm the workforce project leader at Valley Vision, and I welcome you to our mental health advisory. It's a hybrid one, so it comes with all of the fun and surprises that those events offer. So for those of you who might be joining us for the first time, hi, welcome, come on in. You can sit down here until we call you up. For those of you that might be joining us for the first time, Valley Vision is a civic leadership organization whose mission is to bring communities together to tackle the region's biggest challenges and ensure a more livable future. 21st Century Workforce is one of our organization's multiple impact areas, and we serve as a regional organizer to facilitate employer, industry, and community collaboration. And that's what we're doing here today. So thank you for all joining us in that endeavor. Our aims are to connect and align those at our advisories. So today we're incredibly grateful for our speakers and all of you for taking the time to discuss the important topics around mental health care careers. And we change slides. I want to do a shout out to our planning committee that's been wonderful. Karen and Chris could not be here or join us today. They had a family emergency, but has been, instrumental to the success of this planning committee, and so his training. Okay, next slide. We need to do a sound check.
We're good.
Okay. Have there been any questions? And we've got people in the room now. Fabulous. Welcome to all of you that are joining online. We're going to remind you to, if you can, put your camera on and mute yourself. But I'm going to go over the agenda right now. We're at that welcome and introduction stage. We're going to move on to the labor market and trend analysis. Ebony is going to be joining us online. Then we're going to have a 10-minute keynote on behavioral health and workforce opportunities from the Department of Healthcare Access and Information. We're going to have another small keynote on lived experiences and skills in mental health care careers from our speaker from WellSpace. We'll have a short break because we're trying to pack a lot in today. We'll have a lively panel discussion from some really wonderful industry representatives. And then we'll have a facilitating partnerships portion right at the end, and then a conclusion. That's where we're at right now. We want to thank all of our sponsors. The work that we're doing here today could not happen without these organizations helping us move this work forward, connecting us to other partners, connecting us to you. So we really appreciate all of these contributing organizations. And next we're going to have Ebony Benzing, the interim, she's got a new title, so I'm gonna read it, interim director of the North, Greater Sacramento Center of Excellence for Labor Market Research, hosted by Los Rios Community College District, who's here to share industry data and trends to frame this conversation. Ebony, you're ready to go here, and hopefully everything's working on Zoom to bring her in.
Wonderful. Can I get a sound check? Can you guys hear me okay? Yeah.
Yes.
Okay, perfect. Thank you. So, thank you so much for having me in this space today. I am sorry that I wasn't able to join everybody in person. I've had just a little bit of a packed schedule today, so presenting virtually. But anyways, my name is Ebony Benzing. I am the interim director for the Center of Excellence. We're hosted out of Los Rios Community College. And I'm here to share some labor market data about mental and behavioral health occupations in the greater Sacramento region. Next slide, please. All right, so first, a little bit about the COE, who we are and what we do. So there are 8 regional centers and 1 statewide center, and our collective mission is to support the development of career education programs in California's community colleges. Next slide. We do this by using labor market information and other types of data to answer questions such as, what is the employment outlook for students? What skills and credentials are needed for students to be able to access today's jobs in our labor markets? And what programs look ripe for investment for the community colleges? Next slide. So as I mentioned before, today my goal is to provide an overview of the labor market related to mental and behavioral health professionals and jobs across the greater Sacramento region. I just want to give you a little bit of a heads up. So today's presentation is following on a report that the COE released in December of 2020. So it's really an update to that work using kind of more up-to-date data and whatnot. So the framework of this presentation and in the report, we have about 19 mental and behavioral health occupations, which are our categorical buckets for jobs. And then I further broke those down into 5 key areas. So the first area, which is on the left-hand side of the screen, those are our entry-level and paraprofessional jobs, and it includes occupations such as social and human service assistants, social and community service managers, and community healthcare workers. The next bucket that we'll be looking at are psychiatric technicians, which is really just 2 key roles, psychiatric technicians and psychiatric aides. Then we have our counselor and psychologist groups, which includes all of the occupations listed in that yellow box. Social workers, which has all the occupations listed in the blue. And finally, psychiatrists. It's really just one occupation. That's our doctorate occupation. So the first 2 groups, entry-level and paraprofessional and the psychiatric technicians, would really be considered the prime targets for community college training programs, while the last 3 occupational groups would really be those focuses for bachelor transfer programs and graduate degree programs, because they do require advanced education and advanced certifications beyond what the community colleges offer. Next slide, please. So we're going to take a look at our first set of data, which is focused on the employment or job counts and the projected demand for the next 5 years. This data encompasses a 7-county region in the greater Sacramento area, and it starts with a base year or our starting job count in 2022, and then it projects 5 years into 2027. Next slide, please. So in Greater Sacramento in 2022, all of our mental and behavioral health jobs kind of fell into certain occupational groups, or were concentrated in certain occupational groups, and then we're concentrated in certain industries. So our top 3 occupational groups for employment were our counselors and psychologists groups at 36%, entry-level and paraprofessionals at 34%, and social workers at 25%. And then 90% of our area's jobs fell into 10 industries, which are listed in that chart on the right-hand side. It includes state government, which excludes education and hospitals, individual and family services for social assistance types programs, and then offices of other health practitioners. Next slide, please. This table here shows the job counts for each of the 5 mental and behavioral health occupational groups, and compares Greater Sacramento, which is in blue, to California, which is in orange. I'm going to focus on Greater Sacramento, and I'll invite you to kind of check out California's data later on. So in 2022, there were more than 25,000 mental and behavioral health jobs across the region. These jobs are projected to grow at a rate that is similar to that of the state. So in Sacramento, it's about 14%. And then across the state, it's about 13%. Again, Greater Sacramento's mental behavioral jobs are really concentrated in 3 key areas: that counselor group, the entry level and paraprofessional group, and then the social worker group. Over the next 5 years, there will be more than 3,000 job openings each year for mental behavioral health jobs across Sacramento, with, again, most of these job openings being concentrated in those top 3 groups. Next slide, please. So this slide here, because we always look at wage data, one of the goals of community college career education programs is to help students access living wage jobs or jobs that pay a living wage. So this slide compares the low and the high end of the median wage for each of the occupations in each of these occupational groups to what we have as a working living wage, so a living wage for a single adult who's working, and then a living wage for a small family, which encompasses a single adult and then a school-age child. As you can see, just kind of the comparison, it's a little bit of a wonky graph. Most of or all, but except for one occupations, pay a median hourly wage that is above that living wage for the single working adult. That low wage, which is the $18 for counselors and psychologists on the far-hand side of the chart, is really aligned to one occupation in particular, and it's kind of this catch-all occupation for counselors, which includes all of the counselors that aren't really bucketed into the other counselor occupations. So there's a lot of variability kind of in that one occupation there. Next slide, please. So now we're going to take a look at the job postings data. This job postings data comes from online job postings and represents or our job postings that were found online in the last 12 months. So from September 2022 through August 2023. It covers the entire Greater Sacramento region. Next slide, please. So here we have a chart that shows what the job posting trend or job posting activity has been like since January 2022. We see that since January 2020, job postings for mental and behavioral health occupations have increased about 22%. And overall, within my 12-month time frame window, there were about 7,000 job postings from more than 900 employers across our region. Next slide, please. This chart shows the breakdown of those job postings in our 5 occupational groups. And again, 90% of our job postings are in the first 3 occupational groups that I mentioned earlier: our counselor group, our entry level and paraprofessional group, and our social worker group. So these are going to be like our key areas of focus for program development. Next slide, please. These next few slides are really just kind of summaries of top lists. So when I say a top list, it's like, hey, what were the top job titles or the employers or skills and stuff that kind of came out of the job postings for each of these 5 occupational categories. This first slide here for the job titles is really just the top job titles for each of our 5 groups. And the job titles overall, they align with what I expect to see. I expect to see social service assistant job titles. I expect to see mental and behavioral health technician roles in these. So there's alignment. There wasn't really any discrepancy in the titles here. Next slide, please. This slide shows the top or the employers with the most job postings for each of those 5 buckets. I've got some highlights here which show our commonalities across each of the buckets. So what rose to the top for me, or what stood out for me, was the fact that I see Kaiser represented as a top employer for all 5 of these buckets. So they're doing a lot of activity kind of in this space. And I also see WellPath. Other organizations that kind of stood out to me in this was, of course, UC Davis. They are a huge regional employer for us, and they were mentioned in a couple of the categories. And then also that partnership that UC Davis has with Sac County Jail kind of showed up there for social workers. So UC Davis does partner with Sac County to offer mental and behavioral health services to inmates. So that is showing up here as well. Next slide, please. This list shows the specialized skills for each of the 5 occupational buckets. I've only kind of circled 2 things that were kind of interesting to me. Overall, the specialized skills, they're representative of what I expect them to represent. There weren't too many surprising, except for the nursing piece. In both the entry level and paraprofessional group and the psychiatric technicians, nursing showed up as a top skill. I did a little bit more digging to kind of see what that was coming from, and surprise, surprise, that comes from registered nurse job postings in each of these categories. So what I noticed for those registered nurse job postings was that for the RNs, there was a specific kind of overlay of mental and behavioral health skills. So they're working in this capacity. So it might point towards a area for further exploration, like what kinds of skills do RNs need to have beyond their typical training to kind of be able to work in that capacity. So that might be an area of exploration, and another area for future program development for the colleges. Next slide, please. And lastly, we have the most requested certifications. Again, this list looks pretty much like what I expected it to look like, especially since a lot of the mental and behavioral health occupations are licensed occupations in our state, or that they have some kind of certification that they have to obtain to be able to practice in that capacity. So the list just kind of shows you what those top certifications are. And then I did mention at the bottom of those lists where those certifications can be obtained through. Next slide, please. So for the end part of my presentation, we're just going to talk about the mental and behavioral health training programs. This is particularly focused on community colleges and then our 4-year degree institutions, which there are primarily 3 in our area that I was able to pull data from: UC Davis, Sac State, and William Jessup. Next slide, please. So in terms of the types of training pathways that exist in our area, we have career education and general education pathways from our community colleges. For the career education piece, there's several programs that align with the different occupations in the research. That included certified nursing assistant, chemical dependency programs, community healthcare workers, human services, nursing, psychiatric technician, and gerontology. And then on the other side of that, we have our GE focus, our GE education, or with a transfer focus. Some of the pathways that align really well to support students getting into a bachelor degree program would be biology, psychology, sociology, and social work. And then lastly, we've got our baccalaureate and graduate degree programs that align to those more advanced, or the occupations that require advanced education or credentials. That would be human development, gerontology, psychology, and social work. And again, these are programs that are really found in 3 specific institutions in our area. So UC Davis, Sac State, and William Jessup. Next slide, please. And this here is a summary of the supply. So what supply is, it's a measure of the number of awards that are coming from all of our institutions when we aggregate all that data together. And it's used to kind of compare like what gaps might exist in terms of being able to meet the workforce demand in our region. So the blue table summarizes the 3-year average of community college awards, which includes all of the certificates and all of the associate degrees. And that's broken down by career education pathways, general education pathways, and then our healthcare pathways. And then the green table shows a summary of those bachelor degree programs and then our master degree and beyond programs in each of those 4 areas that I highlighted before. So when we look at just our supply in terms of where students are getting awards and how many are coming out, community college, if we exclude health and then our GE or general education pathway awards, we have about an annual average of 160 certificates and degrees. Bachelor's degrees, about 1,100 or just over 1,100 bachelor degrees. And then the master degree plus kind of category, about an average of 130 degrees. Adding all of that together and comparing that to the demand or annual job openings, there's an undersupply. So data is suggesting that there's an undersupply of skilled workers to be able to meet the workforce demand in our region. And that's why we're here today, really, to kind of have this conversation and look at ways to be a little bit more intentional in terms of how can we build up our pathways to be able to meet these workforce demands. So next slide, please. That concludes my presentation. There's my contact information. I'd like to encourage you to check out the COE's website and the report that I mentioned earlier that this was kind of an update to is this mental and behavioral health workforce needs assessment that was released in December 2020. I'll make sure that you guys have the link to the direct report too, so you can read through that. It has some really great findings and includes some interview data as well. So that's it. Thank you.
Thank you so much, Ebony. I'm just going to give us a moment to see if there's any questions either from the chat or from the audience here that we could share with Ebony. Okay, well, thank you so much to Ebony and to the Center of Excellence for continually providing this necessary data for us about jobs and certifications and the skill sets that are needed. So yeah, thank you. And we will definitely send this report in our follow-up materials. And for those of you online, I think we're looking for it to make sure we can link it in the chat too. Okay. Fabulous. So next slide. Okay, wonderful. We have our first keynote speaker. Her name is Ann Powell, and she's going to be giving a speech on the behavioral health workforce opportunities. And I'm going to read her bio real quick. Ann Powell is a health program specialist in the California Department of Healthcare Access and Information Office of Health Workforce Development Policy Section. Ms. Powell is the department's behavioral health program expert and is responsible for guiding the design of grant programs to increase the supply and retention of the behavioral health workforce. Ms. Powell served as a policy researcher at the University of California, Berkeley. Her work encompassed evaluating complex program strategies that make effective use of administrative data to measure the impact and/or outcomes for persons treated in California hospitals, women incarcerated in state prisons and their children and families, and the child welfare and public welfare reforms enacted in the 1980s. Her bio goes on, but I'd like her to start her speech so that we can hear what she has to say and offer her any questions. She ready to go?
Thank you. Next slide. Next slide. So I'm going to just very quickly give you some context. The Department of Healthcare Access and Information used to be the Office of Statewide Health Planning and Development, but as our portfolio of activities grew, so did our status, and we became a department 3 years ago. Our function is to assure access to equitable, affordable, and quality healthcare provided in a safe environment by diverse workforce. Next slide. So our work in the workforce development space is to target services reaching medically underserved areas, to be representative of the population that we're serving through language and race and ethnicity, and in particular to serve members of the Medi-Cal program. We offer financial support in 3 kinds of areas. One is organizations who expand educational capacity, such as universities, individuals pursuing health careers through scholarships and loan repayment, and organizations that build the workforce pipeline, such as high schools and junior colleges who are focusing on preparing our future health workforce. Next slide. So our activities break up in that I'm going to describe briefly is falls into 4 areas. A new profession that we are developing is a certified wellness coach, which is an entry-level behavioral health professional with an associate or bachelor degree in a helping profession such as social work, human development, and health and human services. Education capacity expansion programs through universities, recruitment and retention programs, such as through scholarships, and then our health professions career opportunity programs or pipeline. Next slide. So 3 years ago, the governor, just 2.5 years ago, the governor proposed and legislature approved a brand new initiative called the Children and Youth Behavioral Health Initiative, and committed $4.4 billion over a 5-year period to transform behavioral health for children and youth. We have been charged with designing and launching the Certified Wellness Coach workforce. And as I mentioned, those are individuals who have a bachelor or associate degree in something like social work, human services, health services, and human development. The focus of this workforce is to provide preventative and early intervention supports for children, youth, and their families, and that we are striving in particular to ensure that this workforce reflects the diversity of the youth who would be served where they live, work, and study. We will be offering grants to educational and related organizations to stand up the certified wellness coach workforce through hiring programs. Next slide. We have 6 basic categories of educational capacity expansion programs. We have substance use disorder earn and learn grant program, which is about training individuals become substance use disorder counselors. Social work education capacity and expansion programs, which is both the bachelor and master level social work education. Psychiatry education capacity expansion, self-evident. Train new trainers, where we provide fellowship programs for primary care practitioners, both physicians, nurse practitioners, and PAs, for 1 year to study how to address the needs of people with psychiatric conditions as well as addiction is another area. And then we have a peer personnel training and placement program. And finally, we are offering training for justice and system involved staff in justice and system involved youth agencies. Next slide. In scholarships, I want to focus on the first one in particular. The Behavioral Health Scholarship Program is an annual scholarship we offer to prepare students to be able to go to college and pursue a degree in a behavioral health area. In particular, we start at the entry level from certified personnel such as peer personnel counselors, substance use disorder counselors, and the like. And then for more advanced studies, our Golden State Social Opportunity Scholarship Program provides funds to enable students in master and PhD level programs pursuing clinical licensure to complete their studies. In both cases, these programs offer $25,000 annually for awardees. We also offer loan repayment programs in a variety of areas. Next slide. This year, for the first time in our agency's history, we funded 34 organizations at a level of $117 million in CBO organizations that provide behavioral health services to provide scholarships, loan repayments, stipends, retention bonuses, and hiring bonuses and activities. Next slide. In the area of pipeline, we have two programs. One is our Health Professions Pathway, and this is, pipeline programs, internships, post-undergraduate fellowships, and post-baccalaureate program or internships. We've funded 20 organizations in our first round of organizations serving nearly 32,000 students. And this year, the program just opened for applicants, and we're offering the opportunity for agencies or schools to provide services to youth from foster care, homeless, or juvenile justice system who might be interested in pursuing behavioral health career. And then the Health Career Exploration Program is aimed at conferences, workshops, and other career exploration activities, primarily for high school and early junior high, junior college settings. Next slide. Here's the contact information. I kind of went through this quickly because I wanted to be able to answer questions. We're very clear about our commitment to being strategic about funding opportunities, both in colleges, to individual students and professionals across their participation in achieving their educational and career goals. Thank you.
That was wonderful. Thank you, Anne. It is a lot of information for those of you that are in the room. We have her full slide deck printed up in the back. We'll be following up with that as well. But if anybody, we could take maybe like 1 or 2 questions for Anne, if anybody has anything here or online.
The $7.5 million for the foster youth.
Yes, we, 7.5 million is dedicated to developing wraparound services for youth interested in careers in behavioral health, such as drug counselors and the like.
When is that funding coming out, or is it already out or closed?
It is, we opened the grant opportunity about 2 weeks ago. And if you go on our website, which is hcai.ca.gov, you can look under organization grants, and you'll find that listed. I'll put the link in the chat. I happen to have it open right now. So if there are other questions, I'll consider them while I find the link.
One more.
So with this new certified wellness coach role, is this something that we are foreseeing being used over at the community schools?
Yes.
Okay.
Yes, it is specifically to target children in the educational system, because we know that well-being is a serious concern among youth and children. And our goal is to, for those of you in the educational world, you may know about the, and I'm never going to remember what this stands for, the pupil personnel certified workforce tend to do the more intense kinds of interventions with youth and children, but a lot of their time could be freed up if they had someone doing more preventive kinds of services for children and youth in that setting, and who can identify kids in need of more intensive services to refer them to the appropriate staff in the educational world or in the outside settings as well.
Thank you, Anne. I'm gonna pause real quick. And I just, so that we feel attached to our online environment, I'm gonna have D'Angelo read one of the questions that was for Ebony that we missed and that she responded to in the chat, so.
Sam Blackbird, where can I find out more about the number of needs positions available in the region for directors, managers, or program services? Ebony, you want to go ahead and answer that?
Yeah, so I mean that would be me. So and what I can say about those roles, so they do fall kind of within that entry level and paraprofessional kind of bucket. They're attached specifically to the, I'm looking at it right now, social and community service managers. And depending social and community service manager occupation. Now, depending on who the employer is, the educational requirement and the work experience varies for what they're looking for. So some of the roles have like up to an associate's degree plus a year or two of work experience. And then other roles have like a bachelor's degree, but like 0 years of work experience to kind of step into those roles. So there's a high level of variability in there. In terms of the employers who were like showing up for those job titles specifically, LifeSteps kind of came up on the list. And then a few other kind of healthcare, rehab type and wellness centers were kind of showing up on the list related to that. So hopefully that answers your question. And there's a lot more details about those roles within that 2020 report too. So, okay, that's it.
Ebony. There was another question for Ebony or for Anne?
Her answer is for Brandy.
What was that?
Her answer is for Brandy.
Oh, okay. Let's take one question from online and then we'll move on.
You can go ahead, Brandy.
Thank you. Good afternoon, everyone. My question is quick. One thing I noticed when students do activities for like looking at job postings, et cetera, right, as part of assignments. One big thing the students notice is most employers won't explicitly say they want an associate's degree. It seems to jump from high school requirement, no education, to a bachelor's. So students unknowing, now we've talked about it as a program and they now know how to navigate the 60 units towards whatever language. But is there any initiatives or incentives for employers to start putting an associate's degree? I feel like that's part of the equitable issue students face with feeling like their degree is valid for a 2-year degree, right? Meaning that they're just as valuable as someone with a 4-year degree. And some students feel they are not. And we want to challenge that stigma, right? And so I'm curious if that will align with this new initiative for these health workforce initiatives. Sorry, I've been talking all morning lecturing. Hopefully my question was clear enough.
Yes,
Thank you.
absolutely. What we specifically are targeting community college social work programs in particular, because that curriculum and the internship opportunity that you have while studying both strongly align with the skill set that we want for an individual to become a wellness coach. So yes, and the goal here is that it be a living wage. We estimate starting out that it could be in the $40,000 to $50,000 range, depending on the local school districts. So we're very committed to seeing this work. We also recognize that there is greater population representation in the community college than in the 4-year college. Another reason that we want to target community colleges. So, yes.
Love it, love it, love it. And you are so spot on. My classrooms are so diverse. And those same students that talk to me later say, I didn't see anybody like me when I pursued a bachelor's degree. And or by the time I got to a master's, it was just me as a BIPOC person. And that for some is discouraging, right? Meaning they don't understand why that's happening until they enter the field, right? So I think us talking about it at this level will be very helpful for those numbers to improve with diversity in the field. So thank you.
And the opportunity to give back to your community by working in schools. So you're actually getting to serve your community. So thank you.
Thank you, Anne. And that's kind of a perfect segue for any other, for our next keynote address, who's going to be speaking to these same ideas around honoring lived experience and access in the field. But just so you know, for those of you online, we'll be capturing your questions and making sure that they go to the right person, that we get them answered. And so, but with just in the interest of time, I'm going to move this along. But thank you so much, Anne. We're going to go with the next slide. So we can introduce our next speaker. It's Christy. Do you want to come up? Christy Gonzalez. I can read your bio, but she's giving us a speech on lived experiences and skills in mental health careers. Christy Gonzalez has an MPA, is a WellSpace Health Chief Program Officer, and has been with the organization for 20 years. When she served as Director of Behavioral Health Operations, Christy brought together the medical and behavioral health operations to form a fully functioning, integrated approach to providing patients with a health home. In her role as Deputy Chief of Behavioral Health Operations, she worked to complement the full scope of FQHC operations that WellSpace Health offers by integrating the 988 Suicide and Crisis Lifeline, the full service co-occurring continuum of substance use disorder treatment services, and the many case management support teams. Christy's passion for creating and implementing programs that focus on the underserved in the community gives her purpose. Without further ado, I'm going to hand the virtual mic over to Christy Gonzalez. Thank you so much for coming.
Well, thank you so much for having me here this afternoon. I'm Christy Gonzalez, Chief Program Officer with WellSpace Health, and I'd like to start out simply by saying I'm a product of the community college to 4-year college pipeline. Mission College, Santa Clara, here we go. And so I know what it's like to be a member of the community and start at community college. And I don't know about what any of the students at the community college that you might be involved in are like, but we don't really know kind of what we want to do at that point. And so I was one of those folks that learned it along the way. After I graduated with my 4-year degree, I also went back and got my master's degree doing full online learning. This was pre-pandemic. This was when it was still kind of a little sus. You know, what's this online degree thing all about? Now we all validate it, but at the time it was still a little new. And as mentioned in my bio, I've been with my organization for 20 years. I was a product of that leadership pipeline as well too. So speaking to pipeline and realistic learned experiences on the job or in the community, I think is something that I bring a lot of information to today. If you're not familiar with WellSpace Health, we're a local nonprofit organization in the Sacramento region. We have locations, over 40 locations in 3 different counties, Sacramento, Placer, and Amador. We do a lot of primary care, healthcare, women's health, pediatrics, dental, but we do a lot in the mental health and behavioral health space as well too. We run the local 988 suicide prevention hotline. We do a lot of substance use disorder treatment in the Sacramento area, a lot of mental health services, a lot of case management services. And so coming today and talking about what does that mental health and behavioral health pipeline look like, it doesn't always require letters at the end of your name. You know, yes, we're always going to have room for MDs, we're always going to have room for LCSWs and PsyDs, but we have thousands, literally thousands of employees who don't have the letters at the end of their name, who are just as important and just as equal members of the care team for caring for those patients and clients. And there are a lot of different community-based organizations out there that value that lived experience and value those skills that students or just folks in the community who want to help and give back can take advantage of and harness. So first of all, speaking to those in the room and online today who are in academic settings and you have control over perhaps what some of your curriculum looks like or as much control as they give you, I really urge you to align your curriculum, not just around what texts are we going to read, and what are the core principles that this piece of study requires, but what are some of the skill sets that someone needs going into the mental health and behavioral health world? For example, empathetic listening. What does empathetic listening look like to listen to hear someone's story instead of just waiting for my turn to talk, right? Soft skills, such as what does it look like to have open body posture, non-judgmental facial reactions, right? We all have that one friend who shows everything they're thinking on their face. They're not the right people to work in this field because we're going to hear stories when we work in this field. We need to learn how to be open and approachable to that patient or to that client that we're going to be working with. Clear writing samples. There is so much note taking in the mental and behavioral health field. And so the more that we can help our students learn how to compose complete sentences, proper punctuation, grammar, spelling, all those real core skill sets come into play. And really, mental health and behavioral health services, above all else, are at its core a customer service field. And so acknowledging that when we're interacting with a patient or a client or someone we're going to be serving in this field, how am I a representative of my organization? How am I a representative of my field and of my industry? And every interaction that that patient has with any of us in this industry should really be about customer service. How can I help you? Not how can you fit into my paradigm of this is what needs to happen at an assessment. This is what needs to happen at an intake. No, first of all, let me hear your story. Let me hear from you, and then I'll tell you what I can do for you. Lastly, the second thing I would ask for you in your curriculum development or even just in skill development, if you're working with someone outside of a traditional classroom and you're working with someone who says, I want to go into a helping field, but I don't know if I have the right temperament for it. There are going to be some other skills that are going to be really helpful. Budgets. Basic math and Excel spreadsheets, everybody. I can't tell you how many people I work with who said, I want to get into this field to help people, and suddenly they're in charge of $1 million budget, and they do not know how to do that, right? So basic math, basic Excel spreadsheets, basic budgets, that will lead them far in their career, especially as they develop in their career away from frontline helping, and as they get into management, as they get into directorship, as I did. Any kind of leadership skills, management skills. What is it like to be a leader of a team? Not everyone likes project work, but a lot of leadership skills around project development and project management. So any of those skills that you can develop in that person who is interested in going to this field is going to lead them well. Simple things like how to organize your calendar to make sure you don't double book yourself for things. So important. When someone like myself or an employer is looking for certain skills in someone's cover letter, someone's resume, or in an interview. This is one of those really weird fields where personal disclosure is actually a good thing. A lot of times if you go to a career development workshop, they're all about dress professional, this is how you write a resume, this is how you present yourself, and all those things are still very valid in a mental health and behavioral health field. But I cannot emphasize enough that what an employer is also looking for is the and story. What's your story? So this is a place where in a cover letter or in an interview, it might actually be appropriate for you to disclose, yes, I have lived experience experiencing homelessness. Yes, I have lived experience with a loved one with a mental health diagnosis. Yes, I have lived experience accessing, the ability and disability, world. These are things that are appropriate to disclose, especially when we're talking about that peer or entry level position. But even then, I would still, if I had a choice between two psychologists, I would still take the one who said, I've lived in this community. This is what my family looked like when I grew up. Those kind of lived experiences are really important in this field. And so those of you that are working with people who want to get into this field, let them know that their story is valid. And not only is it valid, but it's going to be welcomed when you talk about it with an employer. At the same time, let's help them understand boundaries. Let's help them understand that just because I have lived this life, it doesn't mean I can get enmeshed with those patients and clients I serve. And so starting that concept of having boundaries with our patients or clients that we serve is really important, because often it's something that we learn on the job. There are a couple of different careers in healthcare that are tangentially related to a mental health or behavioral health career that aren't necessarily something that that Ebony showed, but they're still really connected, and it might be an option for some of the people that we're talking to who want to get into this career. For example, EMTs, paramedics, folks with those types of skills are often employed in a mental health or behavioral health organization. Folks with experiences like an MRI technician. We learned a little bit about nursing in Ebony's presentation. We have a lot of RNs, LVNs who come in to the mental and behavioral health space because their skills are so important for us to reference. Also, take a look at some of the opportunities that AmeriCorps can afford to some folks who are interested in the mental health and behavioral health field. There's Public Health Corps, there's National Health Corps, there's AmeriCorps. There's a lot of really interesting opportunities where someone can get some on-the-job training, but also earn some of those scholarship stipend dollars for their education. There is a bill on the governor's desk right now. It's passed Assembly, it's passed Senate, it's on the governor's desk, SB 525. And it talks about a $25 minimum wage for healthcare workers. Now, depending on how you read that bill, some mental health and behavioral health organizations and fields will be subject to it and some will not. It also has a lot of caveats about rural areas roll out a little bit slower, but take a look at it. I urge you, if it does pass, because if there is a $25 minimum wage for a healthcare worker and some of our behavioral healthcare workers fall under that, that's a living wage. That's $52,000 a year for those of us who are working full time. Imagine a family, where two parents are both in the healthcare, industry. That's a family of four that's bringing in $104,000. So there's some real future here for this next cohort of I say students, but really of any of us who want to get into the mental health and behavioral health field. There's going to be some real livability in it in a way that previously you needed those letters at the end of your name to kind of think that might be a living wage that I might be able to afford. The last thing I'll say is there are a lot of organizations that are out there doing a lot of building their own pipeline and building their own workforce. At WellSpace Health, we have something called the WellSpace Institute. This is where we have a 6-month program where folks from the communities where we are serving our patients, so Oak Park, Del Paso Heights, right, North Highlands, folks that live in those communities come on board for a 6-month training program where they are employees of WellSpace Health. They are paid while they are undergoing a medical assisting certification program. They are paid to take the certification program. And upon successful graduation of the program, they have employment at WellSpace Health. The cohort is only open to about 30 people every 6 months, so we can't get to everyone, but there's a lot of organizations out there doing similar things around building that next cohort of employees and building that next cohort of people who want to be in the healthcare or helping professions. And so I urge you all to be curious with organizations in our region and ask, what are you doing to build the pipeline? And for those of you that are here today and listening today who are part of the formal academic structure, I urge you to ask, how can we lend legitimacy to these types of programs? Where might there be some interaction around certification or around accreditation to really make sure that when someone's getting an associate's degree or a medical assistant certificate through WellSpace Institute, that these things are recognized across many different employers. So thank you for your time today, and I appreciate it.
I'm going to just pose the question in the interest of time because we're running a little behind. Is it okay if we skip break, and if people have to use the restroom, they can just slip out quietly? Okay, all right, so we're gonna skip the break. Now, I am gonna ask though, if anyone online or in the audience has a question or two for Christy, and if, you know, also you can send us questions afterwards, but if there's a question or two we'd like to ask. Anybody online? You out there? Great, Christy, thank you so much. What a wonderful presentation. I really appreciate it. Anyway, so our next slide, we're going to move on to our not that. I was 15 minutes behind. So we're going to just start with our industry panel discussion. We have a great group. We're going to get to see Christy again. That's what we're going to have some more questions for. If we can have our panelists come join up here, I truly appreciate it. And then I'll introduce everyone. We have one guest who is online from Kaiser, Dr. Lycia. Is he fabulous? Okay, great. Okay, good.
I got a beak.
Okay, once we're all seated, I'm gonna just go down here down the I'm gonna start with Jennifer. I did not get a bio from you, so I'll have Jennifer introduce herself first. And do you want to do it right now?
I will briefly introduce myself.
Okay.
I'm one of those people who are extremely anti-violence sometimes. It'd be so long and lengthy. Jenna Malahai, Executive Director of Yolo County Children's Alliance. I've been in a position for almost 3 years. I came up through AmeriCorps. That's how I know Christy, and just kind of worked my way up because of the field, the nonprofit sector and child abuse prevention. It is something that's been dear and passionate to my heart for a very long time. I have a whole bunch of awards and done a whole bunch of things. However, Yolo County is where we work. I've been working here for almost 10 years. And the many partnerships that we have created over the years, of course, are the main contributing factor to the success of our organization. And I could go more into what our organization does when the time is up. Thank you.
Thank you, Jennifer. And I did already read Christy's bio, so I'm gonna move on to Shanine Coates, who's here with us from the Sacramento County Office of Education. Shanine Coates has served in education for 20 years. She is a Sacramento native and began her career as an elementary school teacher with a focus on giving back to her community. Mrs. Coates began serving as the Sacramento County Office of Education's Director of Strategic Initiatives in August 2021. She manages key initiatives at the County Superintendent of Schools, including the development of career pipelines in the education and mental health professions. Thank you for being here. And then I have also So, Jessie Armenta is here. She's the clinical director of La Familia Counseling Center, and she's a licensed marriage and family therapist. Jessie started her career at La Familia as a graduate student, completing her master's degree in counseling. She completed her clinical hours as a clinician, moved up to a quality assurance manager, and now she is the clinical director of the agency. And then virtually, we have Dr. Lycia. Dr. Lycia, he's from Kaiser joining us. He's formerly was the Associate Director of Behavioral Wealth and West County Health Centers in Sonoma County, where he led the expansion of their pediatric department, development of their internship program, and spearheaded efforts in becoming a trauma-informed organization. And supervision therapy with him involves genuine and respectful listening that is aimed at understanding, empowering, and improving the lives of patients and growth of staff supervisees. So that's all, those are our guests. Thank you so much for taking time out of your busy work weeks. You can see their full titles up there. And we have Dr. Lycia there too. Thank you. Oh yeah, you can probably see us this way. So I'm going to ask the panelists questions. They'll each take a turn answering it. I think we'll start just going down one way and then back another. But our first question that we have today is if you could provide a brief overview of your organization, the services you offer, and the size of your workforce. And I'll start with you, Jennifer. Thank you.
I should have stuck down there. Yolo County Children's Alliance has been around since 2002. We were created by the Board of Supervisors, Yolo County Board of Supervisors, as the Child Abuse Prevention Council of Yolo County. So initially, we were doing a lot of coalition building policy work surrounding children's issues in Yolo County. But then when you're doing that work, you tend to realize that in order to do child abuse prevention work, you also need to have programming to support that. And that's when we went to the Strengthening Families framework, which is essentially the protective factors. So we then incorporated home visiting through the HFA model, Healthy Families America model, into our organization. We created a family resource center in West Sacramento. And as the needs arise over the years, particularly insurance need for children, health insurance need, back then, only 42% of Yolo County children had access to health insurance. And we began an advocacy work with other organizations in California. We were the first children health initiative in Yolo County, where we worked to ensure that children who had access to Medi-Cal were enrolled in Medi-Cal, and the families were aware about how to take their children to appointments, how to access different resources within the community. So the Children Health Initiative evolved into the Community Health Initiative, where we incorporated the families into that. Then we also had our own health insurance plan for undocumented children in Yolo County, which was supported by our local Native American tribe, indigenous tribe. And then eventually we went into housing and homeless services. So we serve the entire county, and we serve over 6,000 unduplicated people a year throughout Yolo County. And there may be some programs that I'm tapping into. We do have workforce development as well, but that's who we are.
Wonderful, thank you. And Christine?
Yeah, without reiterating some of the things I've already said, I'll say WellSpace Health is about 1,100 employees strong. That includes full-time, part-time, different contracted employees. We also are, I'll add, we are the region's CCBHC. If you have not heard of this is Certified Community Behavioral Health Clinic. I urge you to go Google it. CCBHC, thank you. We are the only certified community behavioral health clinic in the region. The other ones are in the Bay Area and in LA, that sort of thing. It's a model that California has not adopted, but in other states that have adopted it, it's the idea of bringing clinic-based full-service community behavioral health services, kind of the way that becoming a federally qualified health center is to a clinic. It kind of brings a federal designation to those services. So in about 3-4 years, when the state of California chooses to really adopt it and have it be a reimbursable model, I think you'll start to see a lot more in the region. And then the last thing I'll say about WellSpace Health is simply that we have everyone from medical doctors and chiropractors and psychiatrists, to call center reps and front desk staff members and Medi-Cal enrollment team members and all those great workforce titles that we heard about earlier today. So there really is no one who doesn't belong at WellSpace Health.
May I please add, I forgot to add that we have 56 employees and counting. And we'll talk a little bit more about the roles.
Okay, thanks. So the Sacramento County Office of Education supports all of our Sacramento County area school districts. So that's 13 school districts as well as our charter schools. So all of our local educational agencies. And so we embarked on really a collective impact movement, a partnership with the Department of Healthcare Services for schools as centers of wellness. And so within that, we understand the need for students to have mental health services available in the place that they are most often, which is the school campus. And so what we have within the schools as centers of wellness, also a partnership with our managed care organizations in Sacramento County. We know that there are not 300 plus some licensed mental health clinicians sort of waiting in the wings for this position. Including that are diverse representatives of the students that we serve. And so together we have a career pipeline, which has essentially a variety of support options all the way from high school, all the way through licensure. So that looks like things like peer specialist internship, where students have an opportunity to be trained and understand what the field looks like and how to work in school in a mentorship capacity, as well as graduate clinical interns who are pursuing a master's degree and who need practicum hours. So we partner with universities on that, as well as several full-time positions that we're happy to say do meet that living wage, meet or beat that living wage requirement, family and health community systems navigators, which tie directly to the community health worker position, as well as associate clinicians, where we support them in obtaining their licensure hours, and then our licensed mental health clinicians, and there's more, right? So our workforce right now, our team is about 90, led by Dr. Chris Williams on the clinical piece, leading the team, and then myself leading the career pipeline efforts.
Thank you so much. Jessie, will you tell us about your organization? About what it's doing?
So La Familia Counseling Center is an organization, a nonprofit organization in the Sacramento area, close to South Sacramento. Next month, we will be celebrating our 50th anniversary. So we've been around for 50 years in the community, providing various different services to support and strengthen families, including mental health services. We are one of 9 family resource centers in Sacramento, offering birth and beyond and parenting services. We are a career and job center offering training, internships, and educational opportunities. We offer youth programs, health programs, services to older adults, and we work with our rural and our agricultural communities as well. I am the clinical director of the Children's Medi-Cal Mental Health Program and our community health mental health programs as well. Our agency has over 70 employees, and about 30 to 40 employees are in the mental health division, which is the one that I oversee.
Thank you so much. Now I'm going to ask Dr. Lycia to tell us about Kaiser and your organization.
So I'm from Kaiser, and I manage specifically the neuropsychology department, psychological assessment, as well as the training program. And the training program, I am the postdoc training director, consortium director, and I think that covers all of it. Kaiser is a large employer in the area, second only to, I believe, the government or the state. Our catchment area goes all the way to the Nevada border. So our mental health team is quite large. We have, you name it. We have individual, group, couples, We don't have family therapy, unfortunately. But psychological assessment. My team specifically deals with autism assessment, ADHD, differential diagnosis, any neuropsychological issues. So we kind of cover all bases as far as mental health is concerned. We have eating disorder programs, intensive outpatient, depression care, anxiety, obsessive compulsive disorder. We kind of have it all for the most part. So I hope that kind of answers the question. Yeah.
It sure does. Earlier, when they were sharing the LMI data from the Center of Excellence, Kaiser was the #1 employer in each mental health field. So yes, that's fitting. Thank you, Dr. Lycia. Our second question, and I'm just going to have you answer it, Dr. Lycia, and we'll keep our focus on you and we'll go the other way around here. So if you could let us know what positions you guys have the most difficulty filling, and what skills or certifications are the most demand in this field of mental health?
Good question. We're always hiring, I would say, because we're such a large organization, there naturally comes with that, some turnover. The positions that are actually often the most challenging to fill are the specialized positions. So, for example, people on my team that have specific training in assessing for adult autism, ADHD, neuropsychology. But generally speaking, that's going to be difficult to fill at any organization. There isn't enough, as we call them, testing psychologists in the field. So those are always kind of unicorns to find, so to speak. That being said, we're always looking for individual providers that are, able. Most of my background is actually in clinical psychology, so I've done a lot of group individual therapy, and there's always a need for that. The truth is that there just isn't enough psychologists, therapists, social workers, LPCCs in the world. We just don't have enough. We're always kind of running short. So whether that's at Kaiser or anywhere else, the demand for mental health services has skyrocketed since the pandemic, and we see that as a good thing. We like that people are taking care of their mental health a little bit more, and I wish we had a gigantic army of mental health providers that could meet that need. As far as specific certifications, I think most of the time, I think, is if you're licensed as a therapist, whether it's a psychologist, marriage family therapist, social worker, LPCC, we are often willing to train people in the ways that are needed to fit whatever need our populations might have. Some of the more, I think, icing on the cake, so to speak, when it comes to employees are employees that have training in EMDR, ACT, DBT, some of the more, evidence-based practices. So that kind of knowledge or expertise does go a long way. What else can I add to that? Motivational interviewing, substance use is also a major issue that we're facing. So anybody that has background in treating that is often an advantage, I would say. We also don't have enough bilingual providers. I think I'm one of the few bilingual providers in my clinic, and I wish we had more. So I think that covered most of the question. Let me know if I missed anything.
That's great. Thank you so much.
Mhm.
We're all taking notes fast and furiously. Jesse, could you let us know at La Familia what positions you have the most difficulty filling, what skills or certifications are the most in demand in the field?
So for our particular agency, finding clinicians, whether they're associate licensed, social workers, marriage and licensed, family therapists, or LPCSWs, that is really challenging to recruit, and also psychiatrists. We had the hardest time finding a psychiatrist for a period of time. Bilingual staff, that is very important. I have read an article that said that instead of there's a demand for bilingual staff, but it's decreasing. The number of individuals that are bilingual is decreasing. So in certain areas, you know, it's going to be difficult to be able to provide services for clients or their parents. And at times in counseling, you have to talk to the parents, especially if we're working with children. And how do you communicate to a Hmong parent what's going on? How do you communicate to, we recently got someone from Romania seeking services. It's like, okay, there was not, language services wasn't helpful for us. And just also the idea of being very cultural competent and understanding that there's a lot of different communities that need support and understanding their background and their culture. So in our agency, we do tend to work with other agencies. We at times tend to celebrate with other agencies Hmong Heritage Month, or we'll partner up with another agency to celebrate African American Month. And so to try to build those connections, but yet, you know, those are the challenges that we find.
Yeah, and I would agree with those challenges. I mean, we designed the pipeline specifically because we knew that the clinician position was hard to fill and would continue to be hard to fill. We wanted to make sure that we're providing culturally relevant services. And so I think the other thing that I just wanted to point out for us is that we value all of the careers along the continuum, because we know from speaking to youth and from doing just empathy interviews with youth that youth want someone that understands kind of where they are, who they are, that can connect with them. And so just agree with not necessarily needing the letters behind the name. The mentors, that peer mentors that we have been able to bring through our program make such a difference. And so I just wanted to point that out as well, that as we were building the pipeline, that was definitely a learning for us, that each position in and of itself, in its own right, is extremely important in terms of impacting students.
Very similarly, depending on how the organization gets reimbursed for their services, some of them need very specific degrees, some of them don't. So no matter who you're interacting with, no matter what level of education they have, there's going to be an organization out there somewhere who can use them and is very desperate to hire them. So don't feel that when I give my answer, that's the only, you know, avenue you want to shepherd someone into. But specifically for my organization, the way that we get reimbursed for our healthcare that we deliver, the two most in demand for me are LCSW, licensed clinical social worker, and are a registered or certified alcohol and drug counselor. Because of the way the reimbursement works, there are some where if they don't have that exact licensure, if they don't have that exact degree, you know, they might as well be my call center person. Even if they're a really beautiful, wonderful, capable, culturally competent LPCC, they just don't quite work for my reimbursement structure. But there's someone out there desperate to hire that LPCC.
And that would be us. So that is one of the reasons why we've shied away from Medi-Cal billing.
Yeah.
Within our organization, when it comes to direct services, we're all about paraprofessionals, people with lived experience, people who are off the community and in the community. We tend to hire directly from Yolo County. I'll say 80% of our workforce is a Yolo County resident. And oftentimes have lived there for a generation or is a new immigrant to the country. So one of the things that we've noticed since the pandemic is being really hard hiring people to work with our most vulnerable community members, which are the homeless residents of Yolo County. There's a high level of turnover. Even though some of my staff members my team members are paraprofessionals, when it comes to working with our most vulnerable community members, our homeless residents, there's a lot of navigation as it relates to mental and behavioral health. So we've made an effort to create a training program internally within our organization so that we're able to hire folks that with lived experience, folks who are culturally competent, who do not have all those letters behind their names to be able to work with our most vulnerable community members. In addition to our internal training pipeline, one of the reasons why it's so hard is just the many challenges that comes along with working with that particular population. So one thing that I've been doing on my end, advocacy work that I've been doing on my end is advocating to our contractor, our funders, in order to create some cushion, meaning additional training and additional wellness support for the staff who work with our homeless population in Yolo County.
Well, thank you. I know not everybody was here for the LMI data, so I feel like everybody down here was. Dr. Lycia, you weren't yet on the call, I think, for the LMI data. Oh, you weren't yet, okay. I'm just gonna ask you three here that are down here, if there was anything that you saw presented in the labor market data that stood out to you, does anything surprise you or differ from what you expected?
I'll just jump in again to reiterate that if we are thinking of a mental and behavioral health career as only a mental and behavioral health career, we're limiting the opportunities that we can give to someone who's talking to us about what a pipeline looks like. Nurses, you might not have thought about it, but they're needed. Paramedics, EMTs, translation, right? To Jesse's point, someone who is perhaps, we have a big Afghani population in the Arden Arcade area. We're hiring everyone we can because that is really essential to really good care. And so the LMI data is absolutely critical and everything else. You know, you don't only need a psychiatrist to prescribe psychiatry medicine. You can have a nurse practitioner prescribe psychiatric medicine. And so there are a lot of career opportunities outside of those titles that people can still be a part of this service.
And I think similarly, if we look at our work of really trying to, for our work at SCOE, bring together the mental health and the education systems, I mean, there's a plethora of opportunities there as well. So I just wanted to point that out. Our pipeline work is related to education. We are thrilled if someone comes in and just says, I want to be a part of the helping profession. I don't know what that is yet. And we can train on what does trauma-informed care look like. We can give some of those soft skills and then they can determine what their path is. So we have a variety of on and off ramps in order to support that.
I think mine's very similar to both of them in our agency as well. We are constantly getting requests for volunteer services or internship services, whether it's high schoolers, any type of education. And so we're always saying yes, because that's where it starts. You know, even if you're going to start filing the files and then that person moves up. So just like I said, I personally started as a grad student at the agency and now I'm the clinical director. So it's building our own.
Thank you so much. So I'll move on to the next question. And I'm gonna go online to our to you, Dr. Lycia from Kaiser here. So have the skills required changed due to technology, working from home, or other trends? Are there specific abilities you want community colleges and training partners to focus on?
Good question. I think telehealth presents with its own unique problems, but I think what hasn't changed is just strong clinicians, right? Like somebody that's able to diagnose accurately, that feels comfortable in that realm. Somebody for us, again, that's working from that evidence-based practice approach. You know, we have all kinds of theories here, but as long as the base of what you're doing is evidence-based practice, you can kind of add to that other theories. You know, I'm trying to think, somebody I think that is collaborative, team-friendly, flexible is often great. We take pride in our training program. We have, as far as high school students, bachelor's, and then all the way to doctoral neuropsychology trainees here. So we have basically every level of training. So what else do I want to add to that? I feel like I'm missing part of your question, but I would think one of the things that, having done so many interviews over the last few years with trainees, people that are coming out of college or coming out of a master's program, is I think somebody that's strong in risk assessment is also really important. I feel like I've seen a decline in that in candidates. Somebody that can assess risk, such as suicidal ideation, homicidal ideation, somebody that can feel strong addressing, child abuse, elder abuse is also really great. Somebody that, again, gets back to that diagnostic side of things, somebody that feels comfortable in that realm and doesn't shy away from, having the knowledge of the DSM, but also, diagnosing personality disorders or any other disorder in the DSM. So being strong in that realm, I think, is often a great thing. I feel like I've also seen a slight decline in that. I see so many candidates that, based on like the structure of their graduate program, that maybe wasn't a focus. So those are the main things that come to mind. But if I'm missing something, please let me know.
That was great. Thank you so much. And since you skipped the last question, Jennifer, I'm going to have you respond first to that question of are there any changes in skills required due to technology, working at home, and then is there anything specific you want community colleges and training partners to do?
I will answer the last part about what training partners and community colleges should focus on. There needs to be value built into the work of paraprofessionals. I see it also as an equity issue because most of the time, the people who are paraprofessionals are people of color and people with lived experience, also people who live within specific communities. So when I say value, I'm saying that give them an opportunity to not only be on par with some of the people with all the letters behind their names, but also value their skill set. Let's create a career pathway for paraprofessionals. The reason why we've been so successful in our organization is we've made an effort to hire from the community, of the community, and lived experience. One thing that I was completely in awe of during the pandemic, our home visiting is through HFA, which is Healthy Families America. This is a nationally accredited, nationally recognized home visiting model that the federal government and our state recognize and also fund. They decided to decrease their eligibility requirement for a supervisor position within the framework. So they went from someone that is required to have a bachelor's degree to an associate degree. And I was just so in awe of that, or just college credit, because of that, we were able to promote 2 team members from the home visiting team into supervisory positions. And they are doing an amazing job. One of them does not have a bachelor's degree. One of them eventually got a bachelor's degree. They're doing an amazing job. And without them as members of the team throughout the pandemic and the recovery, well, we'll call it a recovery, I'm gonna do the air quotes. Our teams and our families, we have been supported as much as we've been supported over the last year. So that would be my ask for career training organizations and community colleges. Please recognize the value of paraprofessionals. Let's not just focus on the licensure. I get it, medical bill and all of that, I get that. But please recognize the value of the people who are providing the direct service work to sometimes the most vulnerable community members. Thank you.
I would only add that the burnout is real. The burnout is real, and the better we can do to prepare folks what working in the system really means, the better. Be prepared for, for every, 25 to 50 minutes you're with a patient, you need to do 10 to 15 to 20 minutes of paperwork. Be prepared for that. Be prepared that you still need to do your annual sexual harassment training and your annual bloodborne pathogens training and who knows what training. Be prepared for a productivity value. You went into this profession thinking, I want to help people, and now a boss is saying, yes, but you need 65% productivity time, or I can't meet this contractual obligation. So if we teach our students and the people we're working with what actually working in the field looks like, I think maybe they'll be better prepared. We'll try to do the best we can to make it not so hard, but they need to know it's not all help and flowers.
Yeah, and I think specific to our work in schools, and I think this probably would go for everyone. Everyone hopefully would say relationships. It's just so important. As a member of the team, you're part of the coordination of services team on campus. You're working with just, a variety of family, parents, community, staff, etc. And so really to be able to foster relationships with students as well as adults is really important. I would say one of the other things that we're finding as we work with our career pipeline participants is just being comfortable with running groups, running student groups, facilitating, making presentations. I think it's also a desired skill set.
I agree with everyone. Technology is definitely something important. Having individuals know how to document, having individuals know how to do time management, how to produce those reports. What does the real life work look like? Working with Medi-Cal, the billing, the productivity, all those are real things that people do not understand. And so it'd be nice for students to know beforehand what they're getting themselves into as well. In our field, when we're working with children, telehealth is not always the best form of treatment, and in my agency, a lot of our families are low income. So is the child really able to have a private space? Is the child even able to actually afford having a computer or internet? So these are things that at times we don't take into consideration, that in certain populations, there is lack of resources. And so we can't just expect everyone to, boom, let's do telehealth. That doesn't work for every community. So keeping some of those things in mind. Cultural competence. For us, we've been having promotoras work with us, and these promotoras are community members who have some lived experience. Now they're considered community health workers because that's not down the pipeline. But for us, we've been having them for a long time before it even became popular, I guess. So cultural competency, going back to that, having that understanding that everyone is different. Even if we're from the same culture, that doesn't mean that we have the same values or the same cultures back in our home, right? So kind of having an understanding of that, having an understanding of boundaries, like Christina said earlier, is boundaries and ethics. It is very important to know that there are boundaries. There's a limit to what we can do. And that's where burnout takes place, because at times people do not understand those boundaries. Language, encourage individuals to speak a second language, because that could be so helpful and powerful. And especially if, I myself, I'm Latina, I do speak Spanish. And so for me, it's very important that my child speaks Spanish. And so I have to encourage her, I have to push her. She doesn't want to, but otherwise she's not going to learn, and it's going to stop there. So yeah, those are kind of.
Really nice, thank you, Jesse. I'm just gonna have you take the next question. We're gonna go the opposite direction here.
Can I add something really quickly to this topic that I forgot to mention? It'll be fast. I also struggle with that same thing, teaching my kids Spanish. I need to teach them more. But so we also have what's called the Mental Health Scholars Program, which is a very, I wish this program existed when I was in graduate school. But let's say that we have a front desk person or lab tech, and they want to get into the field of psychology. They can, when they're getting their hours, they can keep their position and train at one of our counseling centers and get paid their full salary as a lab tech or a front desk person while they're collecting their hours. So it's a program that we started not too long ago, but again, I wish it existed when I was around, and I didn't want to forget about that. Sorry.
That's great. If there's a link to that program and you want to put it in the chat or send it to D'Angelo, and then we can make sure it's in our follow-up materials with everyone, for everyone. Thank you. I will say I did raise my kids in dual immersion too, so they speak fluent Spanish, but yeah, anyway, so I just wanted to jump on that parent. So, Jesse, I'm gonna ask you to start with this question. How is your organization currently recruiting diverse applicants?
In our organization, we actually take pride on growing our own. Like I said, we take interns, volunteers at any level, whether there's education or some of our promotores actually were just volunteering, in our agency, and then they got to a position at our job site. One of my office managers, she started, I think it's cleaning the office on a volunteer basis. Now she's my office manager. So there's opportunities in our agency for different positions. In my mental health department, we have different programs, our youth programs, our Birth and Beyond programs that provide those skills for our staff. And I tend to steal them into my mental health department. And they either become like some of our promotoras or behavior partners, and then they transition into clinicians. And as they're going to school, they're keeping their job. We work with them on their school schedule, they're getting paid. And if their school allows them, once they become clinicians, we can pay them still a full salary for them to do their clinical hours. So there's pathways along the way.
Yeah, and for us, we've had a partnership with SETA, the Sacramento Employment Training Agency, and so they have really been instrumental in assisting us with our recruitment. We also began some recruitment efforts with Los Rios Community Colleges District, and we're really looking to strengthen that partnership to ensure that we can continue to have a diverse group of candidates. And then also just the school community itself, because folks are there serving, and so just really being able to tap into the resources that are already in the community.
This is something that I think I could do better at. We do a whole lot of posting on websites, your Indeeds, your ZipRecruiters, that kind of thing. We also do some targeted websites, Bureau of Behavioral Services, that sort of thing. But I think we could do better, because oftentimes I'm coming to events like this and I know that there's a whole workforce out there and I don't know how it's not connecting well. So I'd be interested in hearing from everyone at today's session. Find my email and let me know, what are those job boards that you all know that your contacts are looking at? What are those job fairs that your contacts are going to, and how can WellSpace Health partner with you?
For us, a couple of years ago, I think it'll be 6 or 7 years now, we created a partnership with our local CalWorks department for subsidized employment services. We became a subsidized employment site where CalWorks case managers will place people at the Family Resource Center, and usually that's their entry point to our organization, where they'll come in as a Family Resource Center aide. And it's usually receptionist work, answering the phone, teaching you how to answer the phone, teaching you how to look up resources for families, how to direct them to the appropriate program within our organization. Then eventually, after their year-long commitment with subsidized CWACs, they then become an AmeriCorps member if they're interested. Then that is also another year of additional training or two years of additional training. And after that, miraculously, we always have a position available when they're done with their AmeriCorps term. So we have some team members who have been with the organization for many years who came in through that pipeline. We also have some longtime team members who came in through our local high school, River City High School in West Sacramento, where when they graduated, they started volunteering with us. And now one of the team members is an assistant manager. We also have our Afghan community liaison. His family was accessing services at the Family Resource Center. And when the dad found out an AmeriCorps position was available, he literally told his kid, go talk to Jennifer. And now he's one of our coordinators. So we try to stay as local as possible. Whenever we have a position available, we advertise it to our families, especially people who are accessing services. We work with our county department to advertise those positions. We go to job fairs in our county. When we have higher level positions available, I'm part of a group called Sacramento Sister Circle, and it's a group of Black women in Sacramento. We're either professionals or, doing business people. So I post a lot of jobs on there. I try to be as diverse as possible. And of course, the bigger ones like Indeed and all of that, but we try to keep it as local as possible because the intention is to make sure that we're employing folks from Yolo County.
Dr. Lycia, do you want to tell us how Kaiser currently recruits diverse applicants?
So, good question. I think first I'd like to say that this is just a problem in the field. We don't have enough people of color in the field of psychology. I think we need more people in roles of leadership that represent. I'm a Latino male myself, even though I look pretty white or phenotypically white. I wish there were more people that are making major decisions in this country that looked or had my background, at least. So it's something that we very much value. I think we are always looking for diversity in our staff. I could say in our training program, I'm proud to say that we have probably the most diverse training cohort this year with 15 trainees, and the minority is our white people, our white brothers and sisters. We also, what I would say and add to that is, our training program is an ecosystem that allows for, to speak to some of Sam Blackburn's question, is a small ecosystem that is great for leadership opportunities also. We have people that are passionate about training and become supervisors, and then whenever we have a directorship open, for example, right now I have a directorship open for the internship program that we're restarting or starting up, and I'm looking to my supervisors specifically who have shown some skill set in leading others that I'm hoping to give them opportunity. I say that because quite a few, you can't walk down any hallway here in Roseville or Sacramento and not run into somebody that was either part of the training program in some way or is now part of leadership that started in the training program. So, and all that I think comes with my team and my particular passion around diversity and justice, equity, diversity and inclusion. So I hope that answers the question.
Yes, you did. Thank you. I've got one final question, but it'll be like speed dating. So because in the interest of time, but I think it's an important question. So maybe you could just let us know. The last question is, what is your experience, if any, partnering with community colleges? And maybe if you could briefly state what community college you're working with, if you are or if you're not, kind of shout it out. We'll go around, because I know that there's gonna be people who have more questions. And we have program highlights too. So I'm gonna start with you, Jennifer.
So our experience is quite limited. What we've done with community college was more service and resource based, where we would go to we have a community college in West Sacramento, where we'll attend their opening day or first day of school and provide resources to their students, but we have not partnered as of yet with workforce recruitment.
Thank you.
We work a lot with American River College. They have a great substance use disorder treatment counselor education tract that we have a lot of interns come to us from. We work a lot with Sac City and their community health worker tract. And then we also work a lot with Cosumnes River College around their EMT track. So a lot of kind of specialized tracks that we often have a good conversation with, really good partners throughout Los Rios and Sierra.
So in terms of community college, this is actually where we would really like to strengthen our partnership for recruitment this coming year. So last year, we did partner with the Los Rios Community Colleges District to do an informational regarding our opportunities, but there's so much more that we can do and tap in there.
For us, same thing. We would want to strengthen our relationship with community colleges. We go out there and do outreach of some of our resources. We get invited to their events, however, not directly for internship purposes. So that's something that we can work more on.
I would second that. We have community outreach opportunities with Los Rios, Sierra, most of the local colleges. So, but no direct partnerships with, into our training programs, I would say, or staff positions for the most part. Most of our staff positions do require, or even at the training level, an advanced degree to some extent. But we're open to partnering in any way we can and look forward to it if that's a possibility.
Thank you. I think what I'd like us to do is if you guys could just hold tight, we have 2 program highlights that I'd like to share about, and then we can open up the discussion. So that if it goes a little over, that's at the discretion of those who are, in the audience. But if you could take us to the slide deck. And I would like to give an opportunity. So SETA, it looked like Laura Meckles was on the call. We had their picture, and then I didn't know who was coming for sure. The next slide is one for Anta, the program specialist from the Yolo County Office of Education. He was going to explain a little bit about their program.
Yeah.
Here. Great.
So if you just go ahead and put that through, I'm not going to spend too much time on this.
Next slide. Yeah.
So the programs that we have are really focusing on CTE, like short-term CTE. So if we could get people into the work in the community in under 6 months, that's what we're going to do, right? So then that way you don't have to invest into the 2 years. They can do that while they're working. So we want to make sure that our community members understand what roles there are there, and that there are, for the low price of $3.99, we have all these training opportunities. So for example, the cognitive behavioral interventions is done by University of Cincinnati Corrections Institute. We're actually bringing them out here to do a training on core youth. So working with juvenile justice population. We have one from them as well for IPV, which is interpersonal violence. So working as a facilitator in the community for justice involved people coming out needing those services and counseling that's mandated in those parts. We also have the Community Health Worker Certificate Program, which is a non-credit one. That means it doesn't cost anything. And we work in partnership with Berkeley City College to provide that. The other one that we have along with them is the Social Work and Human Service. That is a cluster of programs which include mental health first aid. So getting that training in that, motivational interviewing, another set of tools and so forth. And then the last one that we're bringing in is the mental health first aid, train the trainers this year. So we have it for youth and for adults. So these are programs, as long as you're a resident of California and you can get to this place, there is a spot for you. Pretty much unless they tell me there's a cap. But the idea is for us to be the wingmen or the support for our community in the work that we do, so that we can help elevate our families this way. One of the main things that we're aligned to, if you're looking into Yolo County, it's called the Roadmap to the Future. That's the initiative that we're all pushing. And this is the work that's going to support that within schools, in the co-navigation of families and so forth. So if you're interested in attending, there are QR codes on the flyers. We'd be happy to have you there. And if you would like to be a partner, please reach out.
We'll also circulate those flyers for you missed it a little bit earlier. I did have a slide thanking you for joining the committee and making this all happen with us. So I just wanted to reiterate that. And then I believe we have a slide for SETA. And if Lauren and it sounds like Rebecca Stevens are on the call, they want to explain their flyer for everyone.
Hi, thank you. Lauren Beckles, Workforce Development Manager with SETA. I will not share all the slides that I have because I know we're short on time, but we do have a flyer that highlights and provides kind of a summary on the different initiatives that we've been involved in that are all centered around mental behavioral health. Our goal has been to attract a young talent and low-income youth of color from underserved communities into the mental health field and to address the shortage of mental health workers in the greater Sacramento region. We are focused on recruiting right now for our ESP program, Equity and Special Initiatives Grant. I will introduce Rebecca Stevens to share a little bit about what that program looks like at the ground level, because we are eagerly recruiting youth and training and providing training opportunities in the mental behavioral health field. Rebecca Stevens will share.
Hello, thanks for having us here. Our ESP program, which is the Equity and Special Populations Program, is a program aimed at recruiting and training young adults ages 18 to 24 in supportive roles in the mental behavior health field with the lived experience. And they go through a peer training academy. We have a couple partners that we have partnered with in the past. We have Cal Voices, and we are currently partnering with NAMI California. And they go through the 80-hour interactive peer training course, and then we identify them. I identify them by calling them, kind of doing like some kind of processing, making sure they have that lived experience. We put them in the training academy. They pass the training academy by taking the test, and then we put them through a work readiness training, where then in hopes that we get them some work experience with some of our community-based organizations that we partner with. And I would say, you know, there's been some bump in the road, some challenges. And so one of the major challenges, some of those partnerships, just kind of getting our peer support specialists, once they are completed the 80-hour certification, that they do get some type of, you know, work experience and kind of foot on the ground so they can kind of feel what it is that they'll be doing in the field. We already have 24 participants who've already completed the program. We have 4 right now who are actually in training, and we have 2 that are going to be starting the training in October. So it's a super exciting program, and I'm happy to be a part of it.
Oh, that's wonderful. I think we have one slide just in case Dr. Lycia is still on and wants to explain the Kaiser training program. The next slide, is he still there? I think there's one more. There it is.
So this is our flyer. We have, like I said earlier, various levels of the training program. So starts at high school, bachelor's. So we have opportunities there. We also have practicum students here, practicum trainees. Those practicum students are specifically focused on sharpening the assessment skills. After that, we have a pre and post master's program, and that's for anyone that's pursuing MFT or LCSW. And after that, we have our postdocs, postdoc residents. We have several tracks for that. We have a trauma-focused track, collaborative care, psychological assessment, general outpatient, and then rounding out our training program. Currently, it would be our neuropsychology postdoc residents, and they're focused on neuropsychology. We will be adding the one piece that we're missing, and that is internship, and that should be coming for the 2024-2025 cohort. And we'll soon hopefully be getting APA accreditation for that. And we'll cover kind of all bases with regards to training. We actually have one of the largest training programs in Northern California, I think second only to the Oakland Kaiser. And we actually, as an organization, Kaiser has probably one of the biggest training programs in the country, because we work closely together at the regional level with training programs throughout Northern California. So that's our training program.
Wonderful, thank you. So those are all the kind of presentation programmatic things that we were going to share today. So now I would like us to open it up to discussion. I know we're at time, but maybe we could perhaps take a few. Let's start with the online folks. Go ahead.
Samantha Blackburn, if you want to go ahead and go. Sam.
Thank you so much. Yes, I am developing a 1-year fully online interprofessional Masters of Science in Human Services Leadership at Sac State. So I'm preparing this program now, and I'm really curious if panelists and even participants might have ideas about whether you think your staff who are growing into some sort of a leadership or management role might be interested in such a program. And I'm also looking for suggestions of what we should include in the curriculum. I want to make sure that this new program meets the needs of our human services staff and leaders in the region. Thank you.
I can just say I'd love to maybe connect with you offline to learn a little bit more about what you're doing and have discussion. Great. Yeah.
Definitely, there could definitely be an interest on our end. However, I would like to offer in this space, just the thought behind tuition. Tuition could be a barrier for people who work in the human services field. Most of us already have student loans, and I know that most programs or universities have some expense behind that. So that would be something that automatically comes to mind.
So all of the panelists sound like they've given approval for sharing their contact information with you. Sam, too, was there other questions that kind of came in the chat? No? Okay. Gustavo, do you think you could pull up those like final slides real quick?
One moment.
Thank you. Gustavo's done an excellent job managing the back and forth, so our whole team it is a group effort to make all these. I did have my phone up here. That's because we secretly text like, you make sure you're doing this or that, you know, just so you know, I wasn't doing anything unrelated to this. So our upcoming events, we have our ICT, our Information and Communication Technology Advisory, and then we have our energy, and that's going to be on building the full stack. So stackable certificates that can prepare you for different types of work where that tech, theory and understanding is going to be needed. Then the Energy, Construction, Utilities Advisory is on water-related careers. That's at the end of October. If you want to, you can use that QR code right up there to register for the Livability Summit. And I'll take us to the last slide. Will bring us home, folks. Thank you so much for joining. Please fill out our survey. That QR code will take you to a survey on this advisory. And we will be sending you follow-up materials. with folks who are willing to share their contact information. We'll be sharing that as in terms of an online networking opportunity for all of us. We'll share the slide deck. We'll be posting a recording of this event online. We're gonna be sending, we have flyers here for those of you that want something, a hard copy. Then we'll also be sending those same documents with follow-up materials. There'll be a lot of attachments that follow-up email, but it'll be a lot of really great information for all of you here and that are joining us virtually. Is there any more? I don't think there's any more slides. There's not. Okay, so this is it. Thank you so much for joining us and taking time out of your day.